what we're going to look at tonight is natural treatments, thyroid toxicosis, and hyperthyroidism. This is part of a long seminar that I'm giving that's a couple of hours on hyperthyroidism and thyroid toxicosis for Module 1B. We've had a lot of questions on Professor Day on some natural treatments for hyperthyroidism. Do be aware that the natural treatments are for people that only have mild hyperthyroidism. And of course, the first thing we'd like to do is reduce risk factors. Stress is a huge risk factor for hypothyroidism. So again, mitigating stress, we probably talk about this in every single module, but really important here. Smoking increases the risk factor, so getting people to quit smoking is important. Stopping iodine intake if they're on iodine, because iodine itself can precipitate hyperthyroidism if the patient doesn't need it. Increasing risk. In fact, really important that the patient not do a whole lot, and treat an infection if present. During Module 1B, I'm going to talk about this very interesting case history that was one of my patients that was hyperthyroid that we're going to look at with all of this. References, Murray's great chapter on hyperthyroidism in the textbook of Natural Medicine. Next slide, please. Diet is also important. High protein diet and avoiding caffeine containing foods, since they're just going to make the heart race more. Caffeine's not a good idea. Well, high protein diet is important because the body's racing. The basal metabolic rate is higher, and so it uses up a lot of calories, and people tend to be protein deficient. Dietary goitrogens also can be used. There are some foods that contain goitrogenic items that prevent the utilization of iodine. So these are foods that the person wants to basically avoid, and they're similar in action to propofol or uracil. So those are these foods that are listed here on the next slide, please. Next slide. These foods cannot be reliably used in the treatment of hyperthyroidism. So again, we should use these foods because they basically have a low goitrogenic content. Cooking inactivates the goitrogenic content, and there's no substantial documentation in a controlled trial that they work. Just be aware they are listed in the medical literature, but they may interfere with thyroid function if the patient has adequate levels of iodine. So that's not our treatment choice, but just be aware of that. It's something that's mentioned. Next slide, please.
Okay.
Dietary goitrogens are transferred from cow's milk, by the way. And in mild cases of hyperthyroidism, they may be something that you can try, but in order for them to work, again, they should be raw, and large doses must be used, and iodine intake must be restricted. So, for example, a half of a head of raw cabbage would be the amount that you would use for one of the foods. Next slide.
Okay.
So we should be on slide number 6 now.
Correct. Oh.
The highest level of isothionates are found in raw soy milk, by the way. Next slide.
There we go. Sorry.
So let's look at some natural treatments of nutritional supplements that have been adequately researched. We're going to look at antioxidants, vitamin A, vitamin C, vitamin E, selenium, calcium, iodine, zinc, L-carnitine, and CoQ10. Those are ones that there has been some documentation on that would be valid. So let's begin with antioxidants. Of course, free radical injury occurs when the body is exposed to excess thyroid hormone. So basically, since there's too much thyroid hormone, almost everybody with hyperthyroidism is at a low antioxidant status. So giving a good multivitamin or a good mixture of antioxidants is important. Next slide. Studies show that when conventional medications like methimazole are used along with antioxidants, then the person became euthyroid faster. So they actually can be used in conjunction with traditional medicines. There was an 8-week study that was done, and they used these very low-dose antioxidants that are listed here and got a good result. Next slide, please.
Okay.
So the degree of cell damage in Graves' disease has been shown to be directly correlated with the amount of oxidative stress that's present. So this may be because it's a combination of antioxidants. They probably have a synergistic effect. Now, some of the ones I'm going to talk about now, like vitamin A and CoQ10, are also antioxidants, but we probably should use more than one for the effect that works together. Next slide.
Okay.
Vitamin A in large doses has an inhibitory effect on the thyroid. It's been shown to decrease the symptoms of Graves' disease. The mechanism by which vitamin A works for this is not known. It may affect iodine metabolization, but they're not sure. Animal trials have shown that vitamin A can alter cellular uptake of thyroxine. It can alter the capacity of nuclear T3 receptors. It can alter thyroid hormone metabolization. So those are projected mechanisms of action in animal trials, but again, they're not sure. How about vitamin C? That's another antioxidant. Animal trials have shown that thyroid hormone in excess can reduce ascorbic acid levels in the serum, blood, liver, adrenals, thymus, and kidney. So because there are low levels, it is suggested that we do give vitamin C to people that are hyperthyroid. And you can see that it hits the adrenals, so you can see that adding adrenal fatigue to this, because there's not enough vitamin C, would be an issue. As you all know, the hormones in the body literally are a symphony. Next slide. Studies have also shown that medications, thiourea and thiouresil, also lower ascorbic acid levels. So sometimes some of the treatments may actually be part of the problem. Next slide. Looking further at vitamin C, studies in human trials in patients with hyperthyroidism have shown a decrease in excretion of ascorbic acid. Next slide. So supplementation is suggested. It does not affect the course of the disease, but it does decrease the symptoms and it helps with the metabolic effects. So I would also look at giving the patient vitamin C. How about vitamin E? Next slide. Vitamin E may be protective against the oxidative damage caused by hyperthyroidism. In an animal study, they used rats that were hyperthyroid. They were given vitamin E, which helped to prevent lipid peroxidation that was associated with hyperthyroidism. Also, they used other antioxidants, and that's suggested you don't use any of these alone, but in combo. Next slide. Studies have shown that patients with hyperthyroidism do have low vitamin E levels, so supplementation would be a very good idea. Selenium. Hyperthyroid patients have low selenium levels, and subclinical hypothyroidism itself may be due to low selenium intake. So this is one of the most important ones that we would want to give is selenium. Next slide.
Okay.
Study of men fed low selenium diets. Their serum T3 levels and serum triacylglycol levels were increased. So selenium should be supplemented in these patients. The dosages, and remember you can get toxic on selenium, but the dosages that are suggested in the medical literature and that I've personally used in patients are 200 to 400 micrograms of selenium. The dosages are not as clear that we should use on vitamins A, E, and C. Next slide. Looking at calcium, calcium metabolism is changed in hyperthyroidism. So Graves' patients have an increased risk of developing osteoporosis And supplementing with calcium can be very important, along with everything else that helps build bone structure, like magnesium and strontium and zinc, etc. Iodine can have a negative effect on patients with hyperthyroidism. In large doses, it temporarily reduces the symptoms by stopping hormone synthesis, but the thyroid can remain suppressed or can resume function at a reduced, same, or increased rate. If you have too much iodine, this can trigger hyperthyroidism in a euthyroid patient, or it can trigger an overactive thyroid to return to normal. So the variable results that you get with iodine, next slide, means it's not predictable. So sometimes it helps, sometimes it can actually cause it. So the literature suggests that we don't use iodine in patients that are hyperthyroid, i.e. thyrotoxicosis, because it may make matters worse in some of the patients or may actually cause the disease process. Questions?
Dr. Smith, before the webinar, I mentioned to everybody that if they have questions, to write them in the chat box.
I can't see the chat box.
Okay, yeah, I'll read them
what
out.
I'm going to do that would be great. Anybody have questions so far, Daniel?
Not yet, no.
Okay, then we'll proceed on to the next slide, which is zinc. RBC zinc levels are lower in patients with hyperthyroidism. So therapy with antithyroid drugs normalizes RBC zinc levels 2 months after the free T3 and free T4 levels are normal. So zinc may be very effective here. In fact, zinc RBC levels in hyperthyroid patients have been shown to reflect a patient's mean thyroid hormone level over the preceding several months. So it's kind of like hemoglobin A1C. That tells us what the patient's blood sugar is 90 days before we actually measure it. And here, RBC zinc levels, which are readily available, may also serve the same function.
Dr. Smith, we do have a question now, actually.
Okay, great.
The question is, do you also suggest following a low-gluten diet like hypothyroidism, since it is an autoimmune condition?
In all autoimmune conditions right now, and this is a great question, I am suggesting that we do two things in all of them, 104 autoimmune diseases. One, we clear up the gut, so we go back and do the 4R program. And two, I am taking my patients off of gluten in any autoimmune process. This is not suggested in the literature yet for hyperthyroidism. It is suggested for hypo, but that is what I'm currently doing in my own practice, is yes, taking them off of gluten.
Great.
Great question.
We do have another question coming up, but I was thinking, what if we answer them all at the end, so that way we can, or would that work for you, or?
I kind of like to take some in the middle.
Perfect.
People have questions, and sometimes they're burning.
Okay.
So if that's okay, let's do that.
No problem. This question is from Phil Roberts. He wrote, I have heard of a Walter Reed study treating hyperthyroidism with lithium and Lugol's. Is that accurate?
Yes, it is, and we're going to discuss that along with the references, Phil, in Module 1B. So I hope you guys join us for 1B. We've applied for this to be a certification at USF in Advanced Endocrinology. So that would be Module 1. The usual Module 1 is now called 1A. That would be Module 1B, Module 1C, and Module 1D. And yes, we're going to spend some time talking about that. So it's absolutely correct.
Great.
Good question.
All right. Well, on that topic, as you just mentioned, 1A, 1B, 1C, one of the attendees just wrote, where is the BHRT? So we do have several events coming up. We do have a BHRT symposium in Las Vegas at the end of February, but we also, obviously, BHRT is covered heavily in this at the end of this month, January 24th through 26th. So another good question.
Another great question. And in Module C, since you asked about BHRT, there's going to be advanced BHRT cases that I will be doing myself. There's also going to be in C other kinds of disease processes that we're going to look at. So we're going to look at a lot of things that have to do with women's health and endocrinology, from vaginal health and sexually transmitted diseases to a myriad of other things, like, for example, can you give supplements to women that are lactating? That's a common question that gets asked on Ask the Professor Day. So we're going to look at a myriad of things in women in C, from fertility changes to really all kinds of specific things. Postpartum depression we're going to look at length, etc. In Module B, which is being held this month in Phoenix, we're going to be looking much further into the adrenals. We're going to be looking at sexual health. We're going to be looking at hyperparathyroidism, hypoparathyroidism. So we're going to look, remember, at the hormonal symphony, the rest of them that we've kind of left out a little bit or didn't have time to talk about in A. So again, that's B. C, we're going to go into more on advanced health. Also in B, I didn't mention, we're looking at methylation. And remember, you can hypermethylate a patient. If you overmethylate them, then they have an increased risk in cancer. So we're going to look at that. And then Module D is just on looking at hormones in males. There's enough now in the literature that we can spend an entire module looking at what happens in men.
Great.
Any other questions at this point?
Not yet, no.
Okay. Module C, for those people who are interested, is in June in Chicago, and then Module D is November in Miami. If you are not able to come to one of the modules, but you can come to the other two, then A4M has made special disposition that you could take one of them online. So talk to your A4M representative. They can get you hooked up to do this. I do really believe that it's important when it comes to the medical boards that people have an actual certification in this area. Okay, carnitine is the next one, so that's the next slide. It's an amino acid used for the transport of long-chain fatty acids into the mitochondria, as everybody knows. It's an antagonist of thyroid hormone in the peripheral tissues because it inhibits thyroid hormone's entry into the nucleus of the cell. Now remember, if we're going to give the patient carnitine because it's an amino acid, we have to have normal renal function because it's cleared through the kidney. Next slide. Study done over 6 months. This one was a randomized, double-blind, placebo-controlled trial. They used carnitine in patients that were hyperthyroid. They studied 50 women that had benign nodular goiters, and carnitine improved the liver profile. It stabilized or improved the symptoms. The patients in the placebo group got worse. The patients in the group treated with carnitine did not. Next slide. When you supplement with carnitine, it may be useful in mild hypothyroidism. The authors of this study suggested that patients cannot take or tolerate traditional medicines, then L-carnitine might be a really good treatment. Pregnant women, lactating women, patients with liver disease, and patients with blood disorders may not be able to take some of the traditional therapies. And so these people might be great people to look at L-carnitine in. There's been no specific trial on pregnant women or lactating women and carnitine, but this was the summary of the authors of that trial. Next slide. The form of L-carnitine should be L-carnitine alone or the acetic or propionic form. The D form should not be used. Another natural treatment for hyperthyroidism is coenzyme Q10. As everybody knows, it's a cofactor in the electron transport chain. It's been shown to be low in adults and children with hyperthyroidism. Next slide.
Yep, I just changed.
Okay, great. The Q10 levels help, and I didn't type this out well, but what it should say is the Q10 levels help the thyroid return to normal when used with conventional treatments. So you can use it with propylthiouracil, etc. It may be helpful to supplement Q10 in patients with hyperthyroidism that have cardiac disease, because as we all know, the organ that uses the most amount of Q10 in the body is the heart. If the patient already has heart disease, then they end up with tachycardia. Then supplementing Q10 may be particularly important in these patients. Dosage 200 to 300 milligrams of Q10. Botanicals, in the next slide, have been shown to be helpful. This is a summary of them in one slide, and we're going to look at them individually. These three, Lycopus, Lithospermium officinale, and Melissa officinalis, these have been studied in humans and animals with preliminary results showing that they're very helpful to treat Graves' disease. More research does need to be done, but effects by all three of those botanicals on the body in laboratory animals were the following. The ability to inhibit the effects of exogenous TSH in rats. It blocks the effects of TSH on the TSH receptor sites located on thyroid membranes. It also inhibits the peripheral deiodination of T4 to T3. It also blocks the effects of antithyroid immunoglobulins on TSH receptors. So those are the mechanisms that these particular botanicals, all three of them, have been shown to work. Not a lot of research was done on the clinical use per se of them. The British Herbal Pharmacopoeia for Lycopus and M. officinalis did give particular dosages. So the dosages have not been standardized. No mention was made of L. officinalis, but these are the suggested dosages in the literature for naturopaths. So all three of them should be used in either as a dried herb, tincture, or fluid extract. Next slide. Okay. There are 8 isolated compounds, mostly from the oxidation products of derivatives of 3,4-dihydroxycinnamonic acid, and they were responsible for the positive effects. This is what they found when they studied it. The effects were reversible, and it did not damage or alter the TSH receptors in situ. So very safe to use. Another trial looked at Emblica officinalis. Study done on hyperthyroid mice for 30 days. It reduced T3 and T4 concentrations by 64% in one study, 70% in the other. If you look at propylthiouracil, it decreases the levels of thyroid hormones by 59% and 40% because they ran this as a controlled trial alongside the other one. So Emblica also decreased hepatic lipid peroxidation. It increased the activity of superoxide dismutase and catalase in mice. Human trials need to be done, but there's not a problem in giving this particular botanical in these patients. Other natural therapies for thyrotoxicosis and hyperthyroid that have been studied: hydrotherapy using cold packs placed over the thyroid TID has been effective, and acupuncture was found in a trial to be an effective treatment for mild hyperthyroidism. Again, what we're looking at here in the natural treatments are for patients with mild hyperthyroidism. Where would I begin? I would pay the patient on a good multivitamin. I would give them L-carnitine at 1,000 to 2,000 milligrams a day with normal renal function, and I would give them selenium at 200 to 400 micrograms. I would start there, and I've done this with numerous patients, and again, for mild hyperthyroidism have been quite successful. Questions?
It looks like we do have some questions. I'm going to open this one up a little bit and unmute some people.
Okay, great.
As we take their questions. So the first question is from Michael Greer. Michael, get ready. I'm about to unmute you, and you can ask your question. Hold on one moment. Let me just get to you.
Hi, Michael.
Michael, are you there?
Hello, Pamela.
Hi, how you doing tonight?
Excellent, excellent. Great for the webinar. It was awesome to actually hear you again and to get some of the insight. The first, I want to just comment that the questions sometimes for me actually cause me not to keep the flow going for the webinar, for the concept. But I was actually so appreciative that you put the ingredients and the botanicals and the products in the first 2 or 3 slides that we're going to focus on, so I can actually go over the slides again and research them again. So I'd
Excellent.
also thank you so much. I'd also love to have more references for some of the information, and I love Dr. Marian Pizzorno. So, but
I
I
do
wanted
too.
to.
There's lots of references actually on the talk that I'm going to be doing in 1B. So I hope you join us for the talk. Actually, I just got done typing all the references for it, and there's 140 of them.
Oh, believe me, I know you. It's this. People have no idea how much work this really is. This is a monster, mammoth amount of work and research on your part. So, thank you so much.
My pleasure, truly.
Thank you, Dr. Greer. The next question is going to be from Glenn Thomas. Glenn, hold on one second. I'm about to unmute you. All right. Glenn.
Hey, Glenn, how you doing tonight?
Glenn, you there? Nope.
Hey, Glenn.
All right. Well, I'm going to go ahead and read Glenn's question, so I'm going to mute you again.
Okay.
His question is, if RBC zinc is low in hyperthyroidism, assume it means thyroid hormone levels are high. How could it be a reflection of the thyroid hormone levels if it's inversely correlated?
Because the body is using up the amount of zinc that's there because of the hypermetabolic state that it's in.
Okay. Perfect. All right. Well, the next question is from Mike Simone. Hold on one sec. Let me find you, Mike. All right, Mike, are you there? Mike? Okay. All right. Well, I have his question as well. The question is, what doses are used with L-carnitine, which I think you did reference to there.
I did reference that.
Okay, cool. And folks, just so you know, we will be sending out this webinar either tomorrow or Friday. So you will have a copy of it. You will be able to review all this again. So.
And just so everybody knows, there are other botanicals also that are going to be discussed in 1B. Club moss, lemon balm, motherwort, and others have also been shown to be natural treatments. So there's quite a myriad of things to look at, actually. Plus, we're going to look at everything conventionally when it comes to thyroid. A lot of times on Professor Day, I get asked, when do I do a scan? All these other kinds of things, and we're going to look at all that so everybody will feel really competent when it comes to hyperthyroidism, hypoparathyroidism, hyperparathyroidism, which is really on the rise now. Big, big issue with hyperparathyroidism.
Okay. All right. The next question is from Sarita Salzberg. Sarita, I'm going to go ahead and unmute you now. Sarita, are you there?
Oh, yes, I am. Hello.
Hi, how are you doing?
Good, how are you?
Good.
I'm new at this. I got to hear you in San Francisco last March, and
great.
Yeah, so it's this wonderful webinar. I just wondered, I noticed the Coenzyme Q10. I was thinking, is that recommended for pretty much everyone? It was concerning that it's folks that are not hypothyroid. What were the recommendations for those folks?
Oh, for everybody, you mean? Well, certainly after the age of 50, people make less Q10, so I always suggest 100 milligrams of Q10 starting at 50. And then, of course, if you're in a hypermetabolic state like we're talking about tonight, you need Q10. And then, of course, there's different drugs. That's Module 4 that causes Q10 to be depleted. There's 4 main classes of those. The statin drugs can cause a depletion. Beta blockers can. Okay. Hydrochlorothiazide. And a lot of the oral agents that we use to lower blood sugar, like metformin, glyburide, glipizide, they all cause depletion of Q10.
So those folks should be on more than 100 milligrams a day?
For each drug, they probably, if they have normal kidney and liver function, need 100 milligrams. So, for example, if somebody had an acute MI and they're over 50, they would need 100 because they're over 50. They're probably on all 4 of those drugs, so they would need a total of 500 milligrams of Q10.
Wow. Oh, that's very helpful.
Yeah.
Thank you.
Okay, good.
Great.
You're welcome.
Thank you, Sarita. Okay, the next question is from Linda Mack. Linda, I'm going to unmute you in just a moment here. All right, Linda.
Hi, Linda.
Linda,
Hey,
are you
Linda.
there? Nope. Okay. All right. Well, I'll go ahead and read Linda's question. Her question was, how much brassica is safe for us to take since these are goitrogens?
Well, no one really knows the answer to that question. I truly wish I knew the answer. That's why we just mention it, but it's really not a treatment for this. No one knows. Certainly I could have added walnuts to this as well. A handful of walnuts a day is not going to be an issue, but if you ate walnuts all day long, could it be a problem? Probably.
Okay. Next question is from Daniel Kai, my apologies. Daniel, are you available? Oh, hello.
Hi, hello.
Hi, Daniel.
Hello.
So, do you
I have
want
one
Can you hear me,
question.
Daniel?
Hello. I have one question.
Yes?
What do you think the HGH for anti-aging?
I'm
Human
sorry?
growth hormone. Human growth
Yes.
hormone.
Yes?
What do you think the HGH for anti-aging?
Oh, well, I'm not going to answer that question tonight. That's not what the seminar is about. Please come join us in Module 1A, and we'll discuss that at length, but tonight we're talking about hyperthyroidism. Okay?
Great. Thank you. Okay. The next question is from Carlton Baker. Carlton, are you available? You there? Carlton? Okay, I'll go ahead and read that question for you. Dr. Smith, what dose of iodine do you recommend for a healthy person?
Well, in Module 1, I discussed this actually quite a bit. That's Module 1A on iodine. And the important thing is that we measure. And there's different ways of measuring it. There's 2 different mechanisms of measurement. I'm in a controlled trial now actually to see which one is the most accurate. But the most important thing is that you measure and you just don't give iodine. Then you give the dosage according to the measurement that you get.
Okay. All right. I have, looks like the last question here that I have right now is from Kathleen McIsaac. Kathleen, if you get ready, I'm about to unmute you here.
Kathleen, are you there?
Kathleen? Okay. All right, Kathleen,
Okay.
I'm going to go ahead and read your question for you. All right. She wrote, would a benign nodule, sizable, in a patient with normal thyroid values respond to similar therapy as you suggest for hyperthyroidism?
Well, it will depend on what kind of nodule it is. It will depend on whether it's a hot nodule, a cold nodule, or a warm nodule. And I do go into the evaluation of each of those at length in Module 1B.
Okay. Well, that looks like it's our last question that we have written down here. Folks, I want to thank everybody. Dr. Smith, do you have anything else?
No, I just I'm glad to do this seminar tonight because we have so many questions on people that want to know natural treatments for hyperthyroidism. And I hope to see you all in a couple of weeks in Phoenix for Module 1B where we discuss all this at length.
Great. And folks, if you have any questions, you can call the A4M office at 561-997-0112. You can visit a4m.com. That's the letter A, the number 4, the letter M as in medicine.com. Or you can email info@a4m.com, and we'll answer any questions you have. We might pass them on to Dr. Smith, or you can speak to one of our education coordinators who can help you out as well. Dr. Smith, I hope everything is well and you enjoy your travels. Folks, thank you for coming out tonight and joining us for this webinar. We really appreciate it. And if you have any questions, give us a call, 561-997-0112. Thank you very much, and we'll talk to you soon. Take care.
Thanks, everybody. Have a good night. Bye-bye.
Bye.